here we're going to mobilize the hip in the same position of the last technique. This position allows us to mobilize anterior and posterior, but in this sort of oblique angle. So what I'm going to do, I'm going to brace with my knee against Kiki's knee. I find the greater trochanter. I push down with the heels of my palms, and there should be a certain amount of glide. So there's a bit of movement. We hold 3, 2, 1. I release, and the hip should follow me up. So again, guys, I push down, 1, 2, 3. I release, and you see a hip follow me up. I'll do it with one hand so you guys can see. So I'm pushing down. You see this space close, and as I release, that space opens up. So here we're mobilizing part of the joint capsule. We're getting some of the ligamentous structures of the abductors. But here we're primarily focused on these accessory motions of the hip, these glides. This is a great technique to do for those clients who are suffering with like hip impingement when squatting or lunging, getting out of chairs, etc. So initially we just push, 1, 2, 3, and release. Once you feel comfortable with that, you're going to interlace your fingers on the underside. Find the tendon of the adductor longus, that's the big tendon, that's the most prominent here. And I'm interlacing my fingers. I'm still using my knee. I lean over Kiki and I just lift. 1, 2, 3, and let go. That was a big pull, just to exaggerate what I'm doing, guys. Initially, I'll just pull here, and I'll stop the pull when Kiki's hip does that. So I won't pull it all the way up here. Because all we're trying to do is disassociate the hip from the pelvis. Here, lean over. Bracing my knee, lean back. The way I do this when I'm working with clients is I'll push, 1, 2, 3, slide my hands around and lift, 1, 2, 3. Mobilize in the anterior direction and then pull in the posterior direction. We can play with the angles here. With my hands, this hand's going under, and I come up here, it just gives me a nice pull. I normally go with my dominant hand underneath first, happens to be my left arm, hand, come over my right, and I just lift. Goes okay? So just mobilizing him nice and gently. Like I said, this really blends in well with the lateral work we've done here. So here, I brace with my knee. Push, 1, 2, 3. Reach under, bend forward, lean, use my legs. Pull. Push, 1, 2, 3. And lift, 1, 2, 3. When we teach this technique in live classes, some of our students have a hard time doing this kind of like butterfly position. We can come in double fists and lean over the client and push down. We can come in elbow and push down. So this is one instance where we do push straight down because we're not trying to mobilize fascia or connective tissue per se. We're trying to move bone. 1, 2, 3. Lift. 1, 2, 3. Use either knee. Don't get too close. a nice firm brace. And what the firm brace does, it allows us to get more motion from here. If I don't brace the knee, her whole body will tend to move toward me like so. So I want to brace her, and I'm even applying pressure here, guys. I'm apply pressure and lift. Apply pressure and push. Because if I don't apply pressure here, when I push, this knee will go zonk. And that could be a bit more pelvis action than we want. We want it to be purely, or as much hip as possible. Pressure, lift.